Good morning, Patrick here from Complete Health, and just wanted to talk about health versus allopathy. Allopathy is a bit of a long word, allopathy. So allopathy is the study of disease and causes of disease as per se, or the study of diseases. And when we talk about the causes, if we have a look at something like what's going on in the current market today, so we've got COVID, and the cause would be the virus. Now, realistically, if you look at allopathy versus a health-based model of taking care of someone, allopathy is looking for a problem to solve, and you're looking to abolish a disease or a dysfunction through the uses normally of medications or surgery. Healthcare looks in a very different perspective on the grounds of that when you look at healthcare, you're actually looking for a reduction in expression of health and what the cause might actually be. Good morning, Tiago. How are we getting on? Oh, both of you. Good morning, good morning, good morning. And so when we look at the reduction in health, there's almost always a reason, and it can pretty much always come to two things. It's either a toxicity, too much, or a deficiency, too little. So if we're looking at something like a disease where you get maybe something like nerve tingling, you might have two different causes. You may have too much stimulation of a nerve, which makes it go dysfunctional, or too little of a vitamin that stops the nerve from working. However, what we're always looking for in our health profession at the moment, not necessarily as chiropractors, by the way, but in our NHS, is we're always looking to abolish disease. So say, for example, let's just take someone that's got high blood pressure, who attends to their GP and says, I'm not feeling quite right, and they take a measure. There's no other symptoms with this patient, but they've got high blood pressure. That's it. They're going in for a health check. They've got high blood pressure. What's the first thing that we tend to do? Well, we put them on blood pressure medications as a preventative. Well, blood pressure medication has a side effect, which means that you're realistically going to then need another medication 6 months to a year down the line to counteract your side effects, and so on and so on and so on. So are we really preventing anything? Whereas what we know, if you can get someone to reduce their salt intake, reduce their fat intake, and take up more exercise, their blood pressure naturally drops. And this is the difference between healthcare and allopathy, is we're looking for a natural preventative solution as opposed to the abolishment of diseases and dysfunctions. So we're not really playing God, we're using nature. It's the biggest difference. Chiropractic, pretty much all natural. There's very few things we have to add. The only thing that I might add to a client's lifestyle is supplements, which is what's found in nature. We've just had to cheat a little bit because food has not got the same nutritional content as we're used to. So maybe before you think about taking your next set of medications, maybe you should think, why is my body doing this, and what can I actually personally do to prevent this from getting any worse? Till tomorrow, take care. Patrick here from Complete Health, and I'll speak to you tomorrow.